Everybody, happy Tuesday. I know I've been on a bit of a hiatus and we haven't spoken in a while, but I'm back now, and this episode I think is one of the most important, not for me, but for you. So if you don't have a pen and paper handy, maybe you want to pause and go grab that, because we're going to have a really important conversation today, and I hope that it helps a lot of you. So I know that in the past, when I've talked about the gifts, as it were, that my chronic migraine illness brought to me, I've mentioned my ability to be compassionate for others and to help others when they're struggling through an illness, especially, and really learning how strong I am as a person. And I meant every word of it, and I still do. And while those are really important parts of my personality and what I've learned in this journey, what we're going to talk about today, I think, is maybe far more important. And that is how to be a professional patient. At 38, to be a professional patient is not something that I would normally be very proud of, but for purposes of our conversation today, I'm incredibly proud of it because I worked really hard at it unintentionally, but it's the gift that keeps on giving. So, 38, obviously, my migraines dominate my medical history and probably the last 10, 15 years of my life. That's not to say that I haven't had other ailments. No illness is pervasive or aggressive or controlling of my life as my migraines, but I have had everything. If you're familiar with my series, you know that I had cataract surgery on each eye earlier this year. I have my foot in a brace right now because there's some inflammation around my ankle. We don't know why. Whatever. So it's big things, it's small things, it's all of the things in between. I feel like I am forever in a doctor's office. Good, bad, maintenance. I actually have my calendar down to where as I'm getting my flu shot this week, and hopefully, knock on wood, I won't be in a doctor's office at all in November. I mean, that seems too good to be true. December, really, I go back for my Botox, which I go for every 3 months. So again, maintenance, nothing scary or new, but maintenance nonetheless. The doctor's visit nonetheless. And in these times of pandemics, it still is anxiety-filled, and all the precautions have to be taken. And when I come home, I have my own routine, as I'm sure you guys do too, when you come home from the grocery store or a doctor's office or wherever you are, in terms of sanitizing the stuff that's been out in the world and yourself as well. So it gives another layer to, going out and that chore. And for me, that's what Botox and a lot of my medical appointments are a chore. I like to get my nails done, but sitting there waiting for them to dry, those like the agonizing 10 minutes. I know, champagne problems. Same thing with the Botox. For me, it's about an hour and a half each way without traffic to my neurologist's office. The appointment's about 20 minutes. I pick something up to eat and I come back and just rest. Again, a champagne problem because Botox does not work for everybody. I know that it will work for me. I know that my doctor is competent. All of those things. But it becomes a chore when you know that you have to stay up to a specific schedule and that your health is determining your life, what your plan is for that day, whatever it may be. And when it comes to our health, while a lot of it is in our control, depending on what the issue is, the most important part I really feel like is what happens in that doctor's office. Whose office you're actually going into, the doctor. That is everything. Everything. Because while he is not a god in a lab coat and you are a mere mortal, I say 90% of what happens in that room and the outcome and how it will affect the rest of your life depends on that person. And picking the right person and finding the right person And not to say that this is an easy thing, right? Let's be realistic here. If we're being real, 100% of that has to do with your health insurance. If you have insurance, what kind of insurance you have, where you live, where you have access to your pick of doctors, especially when we're talking about specialists. When I'm talking about doctors, of course, it could be any kind of doctor, but I mean, like, when I needed a neurologist, I didn't need a neurologist. Well, just any neurologist. I needed a headache specialist. Luckily for me, I live in New York City, and I have more access than someone who lives in a rural country town in the middle of the country. Right? Yeah, I'm still commuting, as it were, to my doctor, but she's in my state and in my insurance. And when she transferred from her original hospital, Montefiore Headache Center, where I initially saw her for the first 8 or so years of our relationship, for lack of a better word, that her new place still took my insurance was a godsend. Getting botulism shot into your body in 41 spots is not a joke. And I trust no one else but her. So, well, as I pray for, the strength to deal with my illness, I pray for her more than myself, because if something goes to her, I really don't know where I would be. Well, I guess I would go back to the headache center and start over, but at least I have access to the headache center. They take my insurance. They're in a reasonable amount of space, still about 45 minutes from my house, but I can get there. That's so important. That aside, when we're looking for a doctor, if we don't have a recommendation, sorry, my eye is twitching, from a friend or a family or a trusted member of our circle, what are we doing? We're Googling. We're calling our health insurance. We're doing whatever it is to find a doctor, right? And that's a crapshoot. A crapshoot. It is also a full-time job. And I have a full-time job where I'm working from home always, not just because of the current world situation. It is a full-time job. It is frustrating. It is aggravating. It is time-consuming and tedious as all hell. The phone calls, the appointments, when can you get in? Oh my God, the rigmarole. Depending on your insurance, if you need a referral, that means you have to call another office and deal with more people to get to where you need to be. And of course, more likely than not, whatever the issue is that you're trying to ultimately treat is new, it's emergency, you're in pain. I never understood this. And before urgent care, which feels like I'm dating myself, which is weird, but if you had strep throat and had to get a doctor to see you, it's like, so today's what? October 26th. And I could see you November 15th. November 15th. I'll be dead by then. Who are all these people that have these appointments? Why are all these doctors always so booked? It's an aside conversation, but I really want someone to answer that to me. Who are these people that knew to book their appointments ahead of time? This many people going for maintenance treatment for strep, for a regular primary care doctor? No idea. But it frustrates me. Nowadays, of course, we go to urgent care, we do whatever, but before that, it's ridiculous. Even with my neurologist, it's not as bad as it used to be at the headache center, but Botox, I have to book my next Botox the day that I'm there for that treatment, 3 months in advance. I guess if I was having an emergent head issue, my doctor knows me, we have a long-standing relationship. She knows I'm coming from far away. It's a whole different ballgame, but just to get in, So I'm hoping that our conversation today will ease some of those troubles for you once you're actually in the room. It will also hopefully help you determine whether you are in the right room or not. And it's something that I've learned from trial and error, and something that you will get really good at too, whether you like it or not. I am still anxious when I go to a doctor, even if it's a repeat visit, even if it's a well visit, whatever that is. For me, it's more maintenance, And I want to make a list. I want to know when I go in there, when I come out, I'm going to feel better than what I did. Now, that's not to say that you're going to get the report that you want or the update on your health that you want. But I'm talking about the answers to the questions that you have and the anxieties that you have while you're waiting to count down to that appointment. Especially in pandemic times, it is so hard to reach doctors. I know they're busy. I know the scheduling. But, you finally get them on the phone, or you finally get them in person, and you had all these things to say and all these things to ask, and then maybe it happens fast. Maybe they rush you. I like to tell a story clearly, and I want you to listen to my story, and then you can go, and then I can go, and then you can go. And not all doctors' personalities are like that. And so I don't want to get all the way home and go, oh, shit. He said something that distracted me, and the most important question I had, I forgot. I even wrote it down and I forgot. And then it's like, oh, God, he's not in on the office, or it's a Saturday at midnight. This conversation we're about to have is to avoid all of those pitfalls where we can help it. And I'm still messing up, but I'm getting better at it, and you will too. So let's start with the first thing. Why are we here? I am such a good professional patient, and I take pride in it now, that after I leave a doctor's office that I haven't been to before, I have now maybe 3 or 4 times in the last 6 months been asked like this. What hospital do you work at? How long have you been a nurse? And I say, what? No one's asked me these kinds of questions before. And I scoff or I laugh, but now I say, no, I just play one on TV. And it amuses me, but it makes me proud. Caffeine break. Because that means that I'm doing a thorough enough job of what I need to know, when I need to know it, and testing if this is the right person for me to be even asking the question to. Okay, so you walk into your doctor's office, whether it's for the first time or the 150th time. Why? Why is this happening to me? Now, of course, the conversation we're having here isn't necessarily just for maintenance. It's more for something has happened. Do you have any idea why I'm in this kind of pain in this part of my body? And they ask you a series of questions. Did you fall? Did you whatever? You say no. Aside from an actual, this is why your body is doing this response, the next best answer I can receive is, I have no idea. I have no idea, but this is what I think. This is what I'll try. This is what you should try. This is what we'll do together. Those are the next best responses. You know why? Because it's honest. Not everybody knows everything. They are not gods in lab coats. And I don't expect them to know everything. With my professional patient status, it's not just my own medical history. It's those around me. My mother, my extended family have been through a lot of, I don't want to say problems, but life, I suppose, right? And health issues. And so I learned by watching around me. And I happen to be a very inquisitive person. If I wasn't a blogger, I would probably be working for CNN beside my beloved Anderson Cooper, and a journalist, because I want to know. Answering one of my questions, so you know, makes me have 112 more if you didn't do a good job answering. And that's what my doctors tend to learn about me real quick. Why? Why is this happening to me? That's first. Depending on the answer, what can we do about it, right? So let's say, for instance, my foot. I have inflammation around my ankle. Why? My doctor flat out says to me, I have no idea, Donna. You didn't twist it, it's not swollen, you didn't fall, you didn't, no, blah, 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 blah. Nope. Not a clue. It sounds like you have inflammation around your ankle. Gives me a brace. Okay, cool. The next question is, how long do I have to wear the brace until you're not in pain? Okay. Keeping in mind this is a doctor I vetted and like. I also should pause here and say, in terms of vetting, yes, we have to do with where we have to get a doctor that takes our insurance and is reasonable for us to get to. However, their credentials are important. I never, ever, ever, literally, pardon the pun, step my foot into a room where I don't know where that person went to medical school and think that it's worthy. Sorry, not sorry. I need to know that wherever you took your education is someplace I deem worthy. And that's not to say there aren't super smart people in schools that they are less prestigious because they couldn't afford or whatever their deal was. Don't care. Not for me. Not for me. It's that simple. I have learned the lesson that I am worth whatever it is. And it's just that simple. So the next step in terms of my foot, he says to me, I can give you a steroid. Can you take steroids? Now, I have trained every doctor I go to know my entire medical history. And it's annoying to repeat, and people maybe think you're exaggerating or, it's not as serious. A lot of times when you're young, people think you're being dramatic, and that's really frustrating and upsetting and a shame, but you have to make them see. So what you really need to do is be incredibly honest with your doctors. Let them know what you're really feeling, when you're really feeling it, even if it doesn't make sense, even if it doesn't fit a textbook. That's the most important thing I've learned in terms of doctors and health. My doctor ultimately believed, my neurologist, how bad my migraines were because that was her job. She saw other people suffering and didn't know why. And because of that, and because of the things I went through for all those years of the trial and error with the drugs and all those things, I know that what I can have doesn't fit in a book. So when my ankle is inflamed and he doesn't know why, that's fine. I have a migraine brain, and I have a lot of inflammation in my body often. So that makes sense to me that he doesn't know. And that it could just be inflammation. That's fine. It doesn't have to be, I've never seen anybody with this. Okay, well, hello, my name is Donna, and now you've met somebody that gets a reaction to X, Y, and Z like that. They're trained that it's not always a zebra. Sometimes it's just a horse with spots, right? But I'm a zebra and sort of wearing zebra colors. So it's okay for them not to know why, or for them not to know, I've never seen it before. And I've learned to be insistent on that. But this is actually what is happening to me, and we need to deal with it now. We're not going to come back in 2 weeks and say, if it's still bad, then we'll decide how to treat it. Never leave a room without a treatment plan. Ever, ever, ever. Or an emergency plan. But back to what I was saying. They want to give me steroids. Now, I am a person with a migraine brain, and so this will work differently for you. But no matter what, if they're giving you medication, ask the doctor what side effects are. My next tip is to never, ever, 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 ever Google something. Ever. 2 reasons. You're going to get a plethora of responses that may not have nothing to do with what you're actually asking. And second, you might find out something that you don't need to know. It will just terrify you or worry you or put that in your head, and you don't need to do that. I always ask my neurologist, what do I have to be on the lookout for? I took a lot of scary drugs, and I always asked all the questions. Which is why when my cataract became an issue, I knew I had vetted my drugs properly. Some things can't be foreseen, some things are unknown. But for the known causes, I always ask my doctor. That little packet that comes in your pills, like the little wrapped up piece of paper or whatever, directions, I suppose. I never, ever, ever read that. I threw that immediately in the garbage. Because I have already asked my doctor, what do I need to be worried about? If it makes your heart race, if you turn purple, if you can't breathe, whatever she told me, this is what you have to worry about. If you experience any of these symptoms, do this. Not all pills can be stopped cold turkey, and that is incredibly important. You need to listen to the doctor's instructions exactly. What do I do? Is this a medication I can stop right away? Can I start weaning right away? Can I take a Benadryl? All of these things are very important. You need to know them. Ask the doctor. If your doctor has no patience for this then you need to get up out of the room and leave. Just leave. They're not for you. Now, I know not all of our personalities mesh with everybody else's, and when you're looking for an experienced, qualified doctor, like I explained, you might not get along with them. They might not have a great bedside manner, and to a certain extent, that's okay. I always say, they don't have to come to Thanksgiving dinner at my house. We don't have to be besties. However, if it's a significant enough health issue where you're not just going for strep throat, you're going to be visiting them often, you're having surgery, you need to be comfortable enough that they're going to sit there behind in that chair. You know how you sat your behind 3 hours waiting for them? In that chair and listen to every concern and question you have and make you feel better about it. That's part of their job, whether they like it or not. And I no longer tolerate doctors that don't want to tolerate me. Some are very defensive. They feel like they're being accused. And we need to be grown-ups. It's not personal, it's business. The business of my health. And I have a right to know every answer to the questions I have. Even if you don't know them. Just say so. Just say so. That's all. So now you know the side effects of the drug you've been given and whatever plan, so to speak, you guys have. If you don't like the side effects you're hearing, or it might interact with some other kind of health condition you have, the next question is, what are my alternatives? If I don't do this, if I'm not willing to risk insomnia or weight gain or a rapid heartbeat, is there anything else I can do now? Not in 6 months, not in 6 weeks, now. Depending on the answer, you might have to make a decision, a hard decision. What I always really liked about my neurologist is that it was never her decision. She trained me, and she gets a lot of credit for this, all my professional patientness. We'll make the decision together. Here are our options. Here are our next steps. Well, I don't think this worked because of X, Y, and Z. What do you think? How do you feel? She always made me make the decision with her about what drug to incorporate, what drug to start eliminating, whatever I brought to the table, we would discuss it together. She would give me her best professional advice, and then I would have to think about it. But, of course, ultimately it was always my decision, but she never made me feel alone in that decision. When I would say, God, I don't know. I don't know. What do you think? And she would say what she thought. And she would explain why she thought that. That is really the most important point. And if their only reason for whatever your treatment plan is because it's what I tell everybody else and it works for 99% of the population, that's not good enough. Why would it work for me, given what you now know about me and my medical history? And then you proceed. What I can't express enough, and it might feel redundant, but it's happened with my eyes, it's happened with my head, happened with my foot. What is the worst case? What happens if this doesn't work? And they say, no, we have to try it. This will work. And if not this, then that will work. Well, but what if not? You need to know. I know a lot of people find the hard truth. They don't want to know the details, But the devil is in the details. If you're having surgery, you don't want to know a worst case scenario. I've always been the person that wants information. Information calms me. I know it's not the same for everybody. And maybe you don't want to know how the surgery is being performed, right? So I had eye surgery. Not everybody wants to hear about the how and the when and the where. I did. But that's not what I'm asking you to ask. You don't need to know the step-by-step of it, especially a surgery you're awake for. But worst case, what are the complications? I know. They're 1 in a billion. You're such a competent person. But I want to know. And you need to know too. You need to be prepared for it because you need to know that they're prepared for it. So they say to you, worst case, you have to have another surgery, or you might not be able to see in the interim, or whatever the horror is for you in that moment. Your next question has to be, then what? What do we do if, God forbid, that 1 in a quadrillion times happens to me? What then? I need to know there's another game plan. What's part B? And make them spell it out for you. I always find that will ultimately give you comfort, even if it's uncomfortable in the interim. And leading up to it, it might cause you a little bit more anxiety because now you know what if, right? But try to relax as best you can, because let's be honest, when people tell you to relax, you don't. You vetted your doctor. You trust your doctor, because that's what it comes down to. If we don't trust our doctors, ultimately, we've given them a license to kill. As you will know by notice, is the title of this video. And trust that whatever is meant for you will come, and that you're strong enough to handle it. And that you've asked all your questions, and you're going to just take it as it comes. Luckily, hopefully, you have a really good support system around you. The most important thing, more important than worst case scenarios, I know I've used the word important a lot, but it is, I'm trying to stress it to you, is emergencies. I have found in my life, no matter the body part we're talking about, emergencies and really severe sicknesses always happen on a weekend, holiday weekend, and in the middle of the night. Why is that? Is it like Murphy's Law? Not really positive what Murphy's Law is, but it's like, whatever can go wrong will go wrong at the least convenient time. That's what I find. And it's in those moments, after many, many, many years of those moments, that I go, shit. I never asked if this happens at this moment, what the fuck do I do? Especially nowadays, we don't want to run to an emergency room and catch whatever God knows is going on around there. You also don't want to have to go to an emergency room alone. I know I don't. Urgent care isn't 24 hours, by my house anyway, although I think it should be, but I guess that's what the hospital's for. What the fuck do I do? And when you have a special illness, you have chronic migraines, you have heart disease, you have something atypical of most people your age or your whatever. The local emergency room is not properly equipped to treat you. I went to an emergency room once during the daytime on like a Tuesday for my migraines, and they gave me Benadryl and Tylenol in an IV. Did that break my migraine? Sure didn't. Did it relieve my pain? No. Did it, lessen my chances of having a stroke? No. This is way before I started going to the headache clinic and way before I found my godsend of a neurologist, way before Botox, way before, it was at the very beginning. Now I know what hospital to go to. I have the emergency number. Always make sure that the doctor you're seeing has an emergency number. A lot of doctors don't. They have that recording that says if it's an emergency, call 911. I find that they have to have that recording is irritating. But why they don't have an emergency number is not acceptable. That's another way to vet your doctors. So let's say they have the emergency number and you can call, but what do I do until I get a hold of you, right? Your doctor ain't calling you back at 4 a.m. on Sunday, like immediately. Or it's Labor Day weekend and they're away and their substitute, who's on call when you're not? What do I do in case of emergency? And there should be a list. My neurologist also taught me the importance of an emergency game plan. Migraines are a little different, so of course the pills that I took, I had emergency pills. Carried them with me always. And I knew when to take them and how to take them, and that was important. And it gave me a lot of comfort. And, when you're really in a lot of pain or really just scared about what's happening to you, there is nothing more comforting than knowing you have a plan. I believe in game plans. I have one when it comes to traveling. I have one when it comes to health. I want to know, if not this, then what? And then, if that doesn't work, what do I do? What emergency room do I go to? What number do I use to get in contact with you? How? How do I make it better? You need to know. Because scary things happen at the most inopportune time. What if I'm out of state? What if I'm on vacation? What if I'm in another country? I went to Europe a few times, luckily enough, and hope to go back sometime when they let Americans in again. But I've traveled alone, and I've memorized the numbers to their 911 version in their country. I know where the embassies are in case I lose my wallet. I've memorized the address and the phone number. Do I now need to know how to say my illness in French? Maybe. Maybe I need to just write it down and keep it on me always. You have to think about those things. And maybe that sounds so far-fetched for you, but if you live in New York and you're in New Jersey and New Jersey doesn't take your health insurance, what if you have state health insurance? That's important to know. What doctor do I see? After my cataract surgery, I had some problems with my retina, and I thought it was going to detach. Luckily, it never did. But I was, supposed to be going there for relief, and I was terrorized by, if this happens to you, get to an emergency room, or just come right here. Okay, but what if I'm not here? What if I'm in Connecticut? And I feel like my retina's detaching because I have all these symptoms that are 1 in a million are happening. Saturday, Labor Day weekend, in the middle of the night in Connecticut. Now what? And they answered my question. They might thought I was out of my mind. I don't care. And that's the other thing. I know that this is really uncomfortable sometimes to insist on a doctor answering your questions. And, when they answer your question, but it really didn't answer your question, you have to say, up, before you go any further. I don't know what you're talking about. It would surprise people in my world to know that I'm not a fan of confrontation. I'm not. I like to say the world's made me this way. It gives me anxiety in the room in the moment, but I have to persist because I know that voice inside of my head as soon as I leave the room, like, Donna, you're a dumbass. Why didn't you know better? You know better. Why didn't you press forward? Why didn't you say, push, get the answer that you need? And you have to be that person. They are not gods in lab coats. They are people just like you and me. And they don't always know better. You have to be an expert in yourself and what you're feeling, and over time, in knowing what ultimately is best for you. I don't care what medical school, look at me, taught them. They don't always know better. You have to know better. You have to know when to trust. You have to listen to your gut, shut out all the noise and the fear, and know better. And you have to insist. And if it means you have to get a little snotty, maybe not as snotty as I would get, that's fine. But insist. And if you don't like the way you're being treated, and you don't like the way the answers are going, or if someone like my former eye doctor said to me, Google it, get the fuck up, get your belongings. No matter what is happening to you, there is somebody better for you. People believe in soulmates in terms of spouses and maybe friends. I believe in that in terms of doctors. We're not driving. Maybe you're a genius. Maybe you're the best eye surgeon there is in the entire planet. You are not my eye surgeon. There's someone equally talented who's not a dick. Sorry. I need the whole package. I need an ounce of compassion. I need warmth. I need patience. Besides the talent. This is how I know I'll find my husband someday, because the list of criteria I have for a doctor that I have no entanglement outside of that office is really high. And I found some really great doctors. They are out there. They are out there, and you will find them and the answers that you need. But you don't need to be mistreated or made to feel incompetent because you're testing them. It's an interview, no doubt. And they need to pass. You're not being interviewed. You should be interviewing them. 1,000%. And until you feel comfortable, then they're not for you. After you get your emergency plan, what are my next steps? Do I come back in 6 weeks? I've been told, I've had a lot of really strange things happen to me. I broke a vertebrae in my back, I don't know, like 20 years ago. Is that possible? No. I don't know, maybe 15 years ago. And, I would be better in 4 to 6 weeks. I wasn't. I was in agony for an entire year. And because of my migraine brain, I couldn't take any of the fun drugs. People seem to really love to alleviate that. So I cried myself to sleep for 6 months, and the following 6 months was slightly better. Everybody thinks everything is going to be better in 4 to 6 weeks. I find that that's bullshit. Unless it's like something, I don't know, you sprained your ankle. I've sprained my ankle and my elbow, and that I believe took 4 to 6 weeks to heal. It's not practical. I want the practical next steps. And going into a room that you're already intimidated by and already afraid and nervous and in pain, it helps to have a list, right? So the things that you want to ask, maybe start thinking about a week before, a month before. Vet it through somebody else. Do you have any other professional patients in your life, or just someone you really trust? I know now it's hard to bring, not most doctors won't let another person come in the room with you, but have them on speakerphone. If your doctor won't allow this, get up and leave. When you're in fear and in pain, you're not listening to the entire picture. And although 2 people can be in the same room and hear 2 different versions of the truth, as a professional patient, I know you have to really put your emotion on the side. I know it's hard. And your fear and your anxiety, and just put it over here, a little box. You'll get to it. And keep going. Find out the information you need. If you haven't walked in with a list, and sometimes I'm typing my list in my phone as I'm waiting in the waiting room. And the doctor starts giving you a lot of information. You say, please hold on 1 second. You ask for a pen and paper if you don't have one on you. And you say, I need to write this down. Or could you write this down? My neurologist always used to give me a typed out paper of what we discussed. What, where stage I was at, the drugs that we were going to stop or start or whatever it was. And the things I had to worry about. The side effects, the emergency numbers. Ask them to write it down for you. Or at least go slowly while you're writing it down. You know, don't feel like you just got all this information tossed at you and you want to go outside and cry and that's all you can think about is don't cry in front of this person. I've cried in front of everybody, side note. Gather yourself, because when you leave the room, you need to have more comfort than when you went in, even if the news isn't fantastic. I know it's really hard, but take advantage of the people that are offering to help you, offering to be on the other side of the phone with you, offering to go over with you. A lot of times other people will have questions that you don't. I wish I could help all of you because I really think I am the best, well, I shouldn't say the best, but I am a fantastic advocate for patients. And I am really good at stopping, you can't bullshit a bullshitter kind of a thing. Stopping that bullshit from coming. That's unacceptable. Whatever you're saying to me is unacceptable. I want to know more. I want to know why. And so when you give me a compliment that you want to know when I went to medical school, oh, honey, you and I can be besties. My anesthesiologist for my first eye surgery, it was a long story. Just check out the video. I was having a day, and I wanted to know why I was not able to eat for 12 hours before my eye surgery because I wasn't being intubated. When they put a tube down your throat, either for a ventilator or to breathe. And he said, intubated? People don't use that word in real life, I suppose. I watch a lot of Grey's Anatomy. But it's also the official word. I'm not saying that you need to memorize all the big words for the diseases you have or the drugs. But my neurologist has always talked to me in medical terms. And when I don't understand her, I'm like, what? What's that? And she goes back. But it made me educated. And I suppose the best patients are the most educated patients. I'm not saying you have to go to medical school, although I feel like I should get an honorary degree for what I know. You need to know more than you have to, if that makes sense. You need to know more than you actually should. You should be able to trust when you walk into a doctor's office that they have your best interests at heart and are qualified and all of the things, and you're going to leave with all your answers without having to press. But honey, that just ain't real life. It's not. And if it's your real life, congratulations, because it sounds like a miracle to me. But it hasn't been my life. But it's made me better. It's made me better at advocating for myself and those around me to get the treatment they really need when they really need it. And I really, really can't express how much I want that for you too. The title of this video comes from a show on Oxygen, hosted by Dr. Terry Dubrow, of former Real Housewives of Orange County fame. And, of course, License to Kill. It's about doctors and nurses who are actually trying to kill their patients. I'm a true crime lover, and so that's right in my wheelhouse. Now, I'm not suggesting that the doctors that you see are actually trying to kill you. But the first thing that they learn, or the first oath that they take, is to first do no harm. And I really believe, and it might sound dramatic, but I believe it, that just because they're not actively, literally trying to murder you, as in this TV show, that they're not doing harm to you by giving you the kind of treatment you need. And now I know they see a lot of patients, and so everybody's needs are different. So this is why it's so important for you to communicate what you need. Ask the questions. Ask them even though you don't want the answer, or you're afraid of the answer, or they don't want to have to sit in that room and talk to you. Make them. Because ultimately you're making them a better doctor, and you will be a happier and hopefully healthier patient because of it. And so with that, class has come to an end. I really, really hope that you get in the care and the good days that you deserve and need. And no matter what comes out of those appointments, you are on your way to recovery. Whatever form that is, it is better than where you started. And so, until next time, guys.